Compliance means following the laws and regulations that we as a healthcare system are required to follow. Compliance is mandated by law, plus it's the right thing to do. When we don't comply, there can be major consequences, like fines, lawsuits, or losing our jobs. And as a healthcare system, we could lose our licensure, accreditation, or ability to participate in the federal Medicare or Medicaid program. Grady is required to meet all standards and requirements related to maintaining our license. Medicare and Medicaid also have strict regulations. The False Claims Act prohibits submitting a false record or claim to the government for payment by one of the federal healthcare programs. A violation happens when someone intentionally files a false or fraudulent claim. In order to comply with the False Claims Act, appropriate medical documentation is essential, and documentation must support every claim for payment. Report any concerns regarding the validity of services and claims to your supervisor or the Corporate Compliance Department. The Anti-Kickback Statute prohibits the exchanging or offering to exchange anything of value in order to induce or reward the referral of healthcare services that are paid for by a federal healthcare program. Next, we will take a look at a scenario concerning the anti-kickback statute.
Guess what? This guy sent me a message on LinkedIn. He said that he would pay me $50 for every patient referral I send his way.
John, you can't do that. You will get in so much trouble if you get caught.
Come on, you can't be serious. He even offered to sponsor our department's holiday party. No one's gonna say anything. Besides, I need the money.
I'm telling you, it's a bad idea.
What is a bad idea?
John got an email from someone offering him $50 for patient referrals. They even said they would pay for our holiday party.
Don't do it, John.
Oh, come on, not you too. All he's asking for is a list of patients and maybe the opportunity to see patients while they're still in the hospital every now and then.
No, seriously, an employee who worked with me a year ago got caught, and they fired her on the spot.
I'm telling you, Grady takes this type of thing seriously. We have to comply with anti-kickback statute. You are asking for trouble.
Maybe you're right.
Again, be mindful before accepting anything of value from vendors or a referral source. Violations of the anti-kickback statute can result not only in termination, but can also result in hefty fines and even imprisonment. Workforce members are expected to maintain the highest level of integrity in business conduct and avoid any conduct that is a conflict of interest or could adversely reflect on Grady's business practices. Employees should refrain from accepting gifts, services, entertainment, or other things of value based on a mutual understanding that decision-making or actions will be influenced with regard to the operation of Grady, and soliciting offers or accepting kickbacks, bribes, or other things of value for the referral of services to another provider. Let's take a closer look at what can happen when you don't comply with a conflict of interest policy.
So how are things at the hospital? Tell me how well you're staffed with nurses.
Good. Short-handed as usual.
Yes, that is exactly what I wanted to talk to you about. My buddy started up a nursing staffing agency, and I wanted to see if you were interested in making a little extra cash. We can offer you $1,000 for every nurse we staff at Grady with your help. Plus, you can get a cut of our revenue at the end of the year. You don't have to disclose anything to Grady. They wouldn't know you're involved with a business or receiving compensation from us. It's just a little bonus.
I don't know. We already have a contract with another agency. Let me see what I can do. I could always use a little extra cash.
Marcus, I understand from your supervisor that you recommended the new nurse staffing firm. I've heard some good things about the nurses who have come to us.
I'm glad I was able to help. A good friend of mine is a co-owner of the company.
So this guy is your friend?
Yeah, he approached me a few months ago. He even offered to make me a business partner, member of board of directors, and give me a cut of what the company makes on each nurse. I win and Grady wins.
Marcus, you didn't disclose this relationship when you recommended the staffing firm to your supervisor. This is a problem.
Why would it be a problem?
Grady's conflict of interest policy requires that you disclose any relationship with the vendor, as well as any financial interest or board participation that you have with the vendor.
I did not realize it would be a problem since I was helping Grady out. I didn't know I had to report any outside business ventures.
Marcus didn't intend to violate the conflict of interest policy, yet the compliance department will still need to investigate this situation. Anytime you recommend a vendor, it is important to report any relationship. The Emergency Medical Treatment and Labor Act, or EMTALA, requires that anyone who comes to Grady seeking emergency care be screened and stabilized, regardless of their ability to pay. If you see someone on Grady's campus in need of emergency care, you can help by escorting them to the emergency department, calling 911, or calling Grady's rapid response team. We're required to provide an appropriate medical screening examination to every patient on our campus seeking emergency care. This screening must be performed every time the patient presents seeking emergency care. If an emergency medical condition exists, we must stabilize the patient prior to the transfer or discharge. The Health Insurance Portability and Accountability Act, known as HIPAA, is a federal law that protects the use and disclosure of an individual's protected health information, otherwise known as PHI. All of us must comply with these regulations. HIPAA consists of 2 rules. 1. There's the HIPAA privacy rule regarding who may access PHI and how it is disclosed. 2. And there's the HIPAA security rule regarding how to keep PHI safe. PHI is generally defined as any information used to identify a patient. Inappropriate or unauthorized use, access, or disclosure of PHI can be considered a HIPAA breach.
Emily, it's been reported that you posted about a certain patient you're treating today.
Wait, what? I don't understand. My account is private. Who would even see it?
That's not the point. Grady's policies state that you are not allowed to post any information about patients.
Okay. I posted about treating a certain movie star, but I didn't say which one.
Posting details about a patient, even without their name, is a violation of Grady's HIPAA and social media policies. I'm going to have to report this to compliance for review.
Use social media platforms responsibly. In addition to avoiding information about patients or patient care, be careful of posting pictures while in uniform or wearing your Grady badge. Avoid negative social media posts about Grady and use Grady tags and hashtags thoughtfully. Also, avoid posting proprietary business information. Using, accessing, or disclosing PHI without a job-related purpose is a HIPAA violation and will subject employees to Grady's zero-tolerance policy. Breaches of HIPAA require reporting to individuals affected, government, and possibly the media, depending on how many people were affected. Being granted Epic access does not permit you to access patient information as you wish. You must have a job-related reason to access patient information. You can also protect PHI by making sure you're sending information to the appropriate party. For example, using the 2-patient identifier check, encrypting your emails when sending PHI, picking up your printouts quickly from the printer, discarding PHI using shred bins, and by securing your usernames and passwords and locking your computer screen when you step away. All Grady workforce members have an obligation to report any suspected compliance violations or concerns. Grady strictly prohibits retaliation against any workforce member who, in good faith, reports a concern about suspected or actual non-compliance. You can report compliance or HIPAA concerns directly to your department leader or anyone in Grady leadership, to the Chief Compliance and Privacy Officer or the Corporate Compliance Department, to the Grady Compliance Hotline, or for HIPAA violations by entering an event in RL Solutions. When we understand how to recognize, report, and resolve compliance and HIPAA violations, we can provide a safe, functional, and supportive environment for our patients, staff, and visitors. Thank you for participating in our HIPAA and compliance module.